First, before we begin, I would like to confirm that you are over the age of 18 and consent to me performing a head to toe on you.
I do.
Excellent. Hello, Mr. Young. My name is Crystal and I'll be your nurse today. I'm going to be performing a head to chest assessment on you. It will take about 20 minutes. Would that be okay with you?
Yes.
Excellent. Before we begin, if you'll please verify your name and date of birth.
Kenny Young, April 26, 1977.
Okay. And just verifying that on your wristband. And then, do you have any allergies?
I do not.
Okay. I'm going to go ahead and pull the curtain closed for your privacy. I'm also going to put on a pair of clean gloves and disinfect my equipment. How are you doing today?
Good.
Excellent. Oops, let's try that again. I am now going to discard my gloves in the trash and perform hand hygiene. Okay. On a pain scale from 0 to 10, with 0 being no pain and 10 being the worst pain that you have ever had, are you experiencing any pain?
No.
If my patient had been experiencing pain, I would assess what makes it better or worse, a description, if the pain travels or spreads, and if so, where, level of intensity, as well as whether it is intermittent. I'm now going to observe for signs of acute distress. No signs noted. I'm now going to assess your behavior. Facial expressions, mood, and affect are all appropriate. I'm now going to assess your level of consciousness by asking you a few questions. What is your name?
Kenny Young,
What year is it?
2025.
Where are you?
At the hospital
And why are you here?
to get a head chest assessment.
Excellent. The patient is alert and oriented ×4, and speech is articulate and clear. I am now going to assess your skin color and integrity. Skin color is appropriate or normal for ethnicity, and skin is intact. I am now going to assess your skin turn by softly pinching the skin on your clavicle. Skin is elastic. I am now going to assess your fingernail color, shape, and contour. Fingernail color is pink, shape is round and normal. I am now going to assess the capillary refill on your finger by pinching it. Capillary refill is less than 3 seconds, which is normal. I am now going to wash my hands and perform hand hygiene and put on a pair of clean gloves. I am now going to assess your facial I'm now going to assess your facial structures. Upon inspection, facial structures are symmetrical. I'm now going to inspect and palpate your head. Upon inspection and palpation, there are no signs of lesions or infestations. I am now going to inspect and palpate your neck. upon inspection and palpation, trachea is midline. Give me just a moment. I am now going to inspect your ocular structures. Upon inspection, ocular structures show no signs of discharge or redness. I am now going to inspect your conjunctiva and sclera. Upon inspection, your conjunctiva and sclera appear normal. I am now going to assess your pupils. Upon inspection, your pupils are a size 4. They are both equal and round and of the same size. I'm now going to shine my light into your eyes and just look straight. After shining my light into your eyes, your pupils are reactive. If you'll please just look at my pen light and follow it as I go close to your nose. Upon inspection of my pen light going to your nose, the pupils constrict and are of reasonable accommodation. I am now going to inspect your external auditory meatus. Upon inspection of your external meatus, there are no signs of discharge, redness, or inflammation. I am now going to palpate your external meatus to check for tenderness. Do you feel any pain?
No.
Upon palpation of the external meatus, there are no signs of tenderness or pain. I am now going to inspect your internal nose structure. Upon inspection of the internal nose structure, there is no discharge or redness. I am now going to press on the right side of your nose, and if you will to close your nostril, and if you will please breathe regular through your left. I am now going to do the opposite. Did you notice any difference with your breathing when you were breathing through each side of your nostril?
No.
Okay. Bilateral patency upon inspection is normal. I am now going to assess your lips, gums, and tongue. Upon inspection, lips, gums, and tongue appear pink and moist. I am now going to remove my gloves and perform hand hygiene. And I am now going to put on a pair of new gloves. I am now going to inspect your posterior chest. Upon inspection, no accessory muscles were used while breathing. I am now going to auscultate your lungs using with 5 positions on each side using a side-to-side pattern. When I put the diaphragm of my stethoscope on your chest, if you will please just breathe in and out. 1, 2, 3, 4, 5, 6, 7, 8, 9, After asciltating correction, the right upper, middle, and lower lobe lung fields are clear. The left upper and lower lung fields are clear. I am now going to assess your posterior lung fields by using 9 locations on each side. When I place the diaphragm of my stethoscope on your back, if you will please breathe in and out. One, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18. Can you turn again? The right upper and lower lobe of the lungs are clear. Excuse me, correction. I just said this is the right, this is actually the left. The right upper and lower lobes of the lungs are clear. All right, you can go ahead and sit back. I am now going to listen to your heart sounds and verbalize the landmarks with my stethoscope by using the diaphragm of my stethoscope. Aortic, left second intercostal space. Pulmonic, I think I said, correction, this is the right second intercostal space. Pulmonic, left second intercostal space. Erb's point, left third intercostal space. Tricuspid, left fourth intercostal space. Lower left sternal border. Mitral, left fifth intercostal space. Medial to the midclavicular line. This is where I would also check for the apical pulse. I will now listen to your heart sounds and verbalize the landmarks by using the bell of my stethoscope. Aortic, pulmonic, Erb's point, tricuspid, mitral. This is also the right second intercostal space, left second intercostal space, third intercostal space, fourth intercostal space, fifth intercostal space. All heart sounds are consistent and regular. I will now listen to your carotid pulses. Your right carotid pulse, your left carotid pulse. Carotid pulses are normal. I will now palpate your radial pulses, your right radial pulse, your left radial pulse. Upon palpation of your radial pulses are normal. This now concludes the head to chest assessment. Thank you for allowing me to perform this on you. I will now disinfect the equipment that I used using a disinfectant wipe. I will be sure to clean the stethoscope the thermometer and the pulse oximeter probe. I will also be sure to use an alcohol prep pad to clean the bottom of my stethoscope. I will now remove my gloves and to perform hand hygiene. I will now lower the bed to the lowest position. I will pull up both side rails. I will ensure that the bed is in the lock position, and I will also ensure that the call light is within your reach. With a pain scale of 0 to 10, do you have any pain?
No.
Okay. I will now perform hand hygiene.